and the next technology is radial pulse wave technology, and that penetrates up to 2.4-inch depth. And these are pressure waves that target more of the superficial tissue layer. So it's deeper than something like the modalities that we've used in the past, like electrical stimulation and ultrasound, but it's more superficial than the other two technologies. And it gets a wider base of area. So it's effective for soft tissue, including tendons, muscles, and ligaments. This technology specifically really helps to break down scar tissue, adhesions, and calcifications. And one of the things that's really critical, that why this helps so much, is that a lot of times the scar tissue and adhesions and calcifications is contributing to your ability to not get circulation to get the full healing effect naturally, that your body gets stuck in the process and it can't heal on its own. So this helps to break that up so that you can get that circulation moving again, so that you can go through the healing cycle that your body's trying to do naturally, but it gets stuck in. Another added benefit is that it helps if it's in an area where you have cellulite or you have body sculpting that you want done, it can actually work on that as well. So that depends on the area of if that's more of a soft tissue issue. And there's a whole aesthetic line to this technology as well.